Hello everybody, and thank you for joining me in this new short video presentation from ECG Exercises. This is the ECG exercise number 30, and the ECG belongs to a 58-year-old man with frequent palpitation, documented supraventricular tachycardia, most compatible with AVNRT, who was admitted to our hospital for EP study. Here we see the 12-lead ECG, which clearly shows a right axis deviation, incomplete right bundle branch block pattern in precordial leads, T-wave inversion, and also poor R-wave progression. Putting all these findings together, we can propose the diagnosis of congenital pericardial agenesis. But why this creates these ECG findings? Here is the chest X-ray of our patient compared to the normal chest X-ray of another person. We see a leftward and also posterior shift of the heart due to agenesis of pericardium, and this is exactly what creates the ECG findings. In chest X-ray, we have the so-called Snoopy sign, and here this is the Snoopy sign exactly as seen in our patient, which suggests congenital pericardial agenesis. CT scan of this patient also confirmed the diagnosis. As you can see, there is no pericardium. We cannot see the pericardium, and that's the reason why, compared to the normal CT scan, we have a leftward and posterior shift of the heart, and this movement creates the ECG findings that we saw already together. This disease was first described by an anatomist named Rialdo Colombo in 1559. It is extremely rare. The prevalence is somehow between 2 to 4 per 100,000 and is more frequent in male persons as in our patient. It's usually is an isolated finding, but we have to remember that these congenital pericardial agenesis can coincide with some systemic and cardiac disorder, especially atrial septum defect, tricuspidal atresia, bronchogenic cyst, pectus excavatum, or some more rare syndromes like Vater syndrome. The most prevalent form is the complete left-sided, and after that complete bilateral and complete right-sided. In rare cases, we have some partial right or left-sided pericardial agenesis, and exactly in these patients, the complications might be more prevalent because of the small agenesis. There might be some invagination of coronary arteries on chambers, and these may produce symptoms. But usually in patients with complete or complete right-sided, left-sided, or both-sided pericardial agenesis, the patients are asymptomatic. So back to our patient, the tachycardia was AVNRT, and this is on the left side is the tachycardia, and on the right side the ECG in sinus rhythm, which was successfully ablated using 3D mapping because the anatomy on the fluoroscopy was very difficult to interpret. Once again, thank you for joining me here, and I hope you enjoyed this short video presentation, and I would like to invite you joining me here in my future short videos. Thank you.